Hello guys, this is Harni from third year EC. Now let's discuss the case study in wearable devices, and the topic is understanding the use of smart textiles and the body area networks in the health monitoring. A rehabilitation center is looking to deploy wearable technology to monitor patients recovering from orthopedic surgeries such as ankle or knee replacements. The wearable should help track joint movement, muscle activity, temperature, and ECG. The solution should be designed using the smart textile integrated with the body area network and should be wirelessly transmit the data to physiotherapists for remote assessment and feedback. Introduction. The increasing demand for efficient and accessible healthcare has driven the deployment of innovative solutions in the patient monitoring. One such advancement is wearable technology, which was revolutionized how patient data is collected and utilized. Wearable devices, particularly those integrated into the clothing, offers a non-invasive, continuous, and real-time method for monitoring vital physiological signals in the context of orthopedic rehabilitation, timely assessment and tracking of recovery parameters such as joint mobility, muscle activity, inflammation, and cardiovascular status for critical for successful outcomes. Orthopedic surgeries such as knee or ankle replacements often require extensive physiotherapy and routine clinical visits to ensure the optimal recovery. However, traditional rehabilitation approaches are limited by infrequent assessment and subjective feedback. A smart textile based solution integrated with the body area networks offers a more efficient approach by enabling remote and automatic data collection and transmission to health providers. This allows physiotherapists to make informed decisions based on the real-time data and personalized rehabilitation program effectively. Literature survey. Numerous studies and technologies have demonstrated the effectiveness of wearable devices and smart textiles in healthcare. The following are the key contributions. Stoffa and Chiolria emphasize the potential of wearable electronics in biomedical monitoring, the adaptability and comfort of the smart fabrics in continuous health tracking. Monato discussed the wearable system for rehabilitation, highlighting the advantages of real-time data acquisition in improving physiological therapy outcomes. Recent advancements in conductive textiles have enabled the integration of sensor directly into the garments, allowing for accurate measurement of movement, muscle activity, and physiological response like heart rate and body temperature. Band technologies such as Bluetooth Low Energy, Zigbee, and Near Field communication allow seamless low power wireless communication between sensors and remote servers or devices. This finding supports the feasibility and the benefits of using a smart textiles and band in real world health monitoring application, especially in rehabilitations. Basic criteria for the implementation of the strategies. Multi-parameter sensing. One of the most essential functional requirement is the system ability to simultaneously monitor multiple physiological and biomechanical parameters. In orthopedic rehabilitation, various metrics needed to be tracked to assess the patient's recovery progress. Joint movement tracking through the flex or a strain sensor helps the determine the range of motion and joint flexibility after surgeries like total knee replacements on ankle fixation. Electromyography is essential for monitoring muscle activation and performance, which helps in evaluating muscles re-engagement and strengthen the building over time. Electrocardiography is necessary to ensure the cardiovascular stability during the rehabilitation exercise, especially for elderly patients or those with a pre-existing condition. Temperature monitoring at or near the surgical site help detect the signals of inflammation or infection early in the healing process. Methodology. Step 1. Requirement analysis. Identify the key physiological parameter for monitoring. Determine the sensor types and suitable textile material. Step 2. Sensor integration. Use textile based stretch sensors for joint movement. Conductive fabric electrodes for EMG and ECG. Thermosensitive fibers or IR sensor for temperature. Step 3. Band setup. Use a microcontroller units like ESP32 or Arduino Nano with BLE or Zigbee. Config wireless transmission to mobile or cloud platform. Step 4. Software interference. Develop a mobile app or dashboard for physiotherapists. Implement data visualization and alert features. Step 5. Prototype testing. Conduct a testing with the sample patients in the rehabilitation center. Collect the feedback and refine the system for better accuracy and comfort. Solution. The proposed solution is a smart wearable rehabilitation garments such as a knee or ankle sleeve embedded with a multiple textile based sensor. The sensor continuously monitors joint movement using a stretchable flex sensor, muscle activity using dry fabric electrodes placed over muscles, temperatures to detect inflammation using a thermochromic or temperature sensitive textiles, ECG through the textile electrode integrated around the torso. All these sensors are connected by a central controller forming a body area network. The controller processes and transmits the data wirelessly to a cloud or mobile platform, allowing the physiotherapist to monitor the patient progress in real time. Alerts are automatically sent if data indicates abnormal activity like poor mobility or signs of infection or inflammation. Conclusion. This case study proposes a comprehensive future ready solution that leverages the synergy of a smart textiles and body area network to revolutionize orthopedic rehabilitation by embedding a stretchable, lightweight, and washable sensor directly into the wearable garments. The systems enable real-time, non-intrusive and continuous monitoring key recovery metrics such as joint motion, muscle activity, body temperature, and ECG signals. These parameters are critical for assessing the patient progress after surgeries like knee replacement, ligament reconstruction, or ankle fixation. The wearable solution not only supports the accurate and real-time data acquisition but also enables wireless transmission using a low-power band technology such as Bluetooth Low Energy Zigbee. This allows for seamless remote sensing monitoring where physiotherapists and healthcare professionals can access the live patient data through the cloud-based dashboard or mobile application. Consequently, they can track the rehabilitation trends, detect abnormalities, provide timely feedback, and adjust therapy protocols and to go without the requiring the patients to make frequent hospital visits. Thank you.